Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and the Medicine Rehab Fitness Institute. My name is Thomas Hammett, and I am the Director of Operations at Pinnacle Lifestyle Medicine and a co-founder of the MRF Institute. I'm co-hosting this episode with David Flench, President and CEO of the Medical Fitness Association. Hey, David.
Hey, Thomas. How you doing?
Great, man. Good to see you again.
Yeah. Well, hello, everybody. We're excited to have on our show today Doug Ribley. Doug has been active in the development and administration of quality health, fitness, and wellness programs and facilities for over 40 years. He's worked in the corporate, commercial, and hospital-based arenas. And after 25 years with the Cleveland Clinic Akron General, Doug recently retired as Senior Vice President of Health and Wellness Services. But Doug continues to serve the industry as President of Douglas A. Ribley and Associates, which is a healthcare advisory business that has served as the lead consulting organization for dozens of wellness center turnaround and new development projects. Doug's a past board chair for the Medical Fitness Association and is a recipient of several awards, including the MFA's Pioneer Award, Founders Award, Distinguished Service Award, and the Special Recognition Award for his contributions to the advancement of the medical fitness and wellness profession. Hey, Doug, thanks for joining us. Can you maybe share just a little bit more about your background with our audience?
Oh my gosh, what more is there to say? Thanks for going through that. Sorry that people had to listen to all that, but no, I think that pretty much covered it. I mean, I spent the bulk of my career with Akron General and then Cleveland Clinic, and it was a pretty special experience. Early on in the early '90s, where we kind of innovated around the clinically integrated health and wellness center model, but not only came up with the concept, but then we invested millions of dollars to develop the first. And with the success of that, we got to do it a second and a third time, and then help expand that model with health systems across the country. So it's really been, a lot of people I think about, you talk to people that have gone to college and gotten a degree, and I think they say people change careers 3 or 4 or 5 times in their life. I'm one of those people that I went to school for my passion, and I've been in this industry my entire career and love every minute of it.
That's thanks for sharing that last part of your story, Doug. So I'm a physical therapist. This is the first time that you and I are meeting each other, for listeners that don't know that, but we're kind of doing a real intro here too. And I came out of practice a few years ago to start doing some of the work that I'm doing. But I always tell people, I mean, all the work that I'm doing is still largely revolved around physical therapy and the PT profession, as well as medical fitness and integration. And I feel really lucky to be working in the field that I'm, graduated out of. As I know David shares that passion as well. So I think we're all three really lucky with that. So, again, first time meeting you, I'd love to hear about the work that you've done with wellness center turnaround projects, and in particular, just learning more about what those projects look like, and in your experience, what the typical profile of a wellness center that needs a turnaround would look like.
Sure. So much of my work throughout my career, whether it was when I was employed with Cleveland Clinic Akron General, or whether it has been through my own company, Douglas A. Ribley Associates, has been similar. We would get, because of our success at Cleveland Clinic Akron General, I would get a phone call, and people would say, we have this beautiful center and it's not meeting expectations. And so right away we start to dive into, well, what does that exactly mean? Not meeting expectations. Are we not producing meaningful health outcomes through the work we're doing, or are we not able to support those programs and services financially because the center isn't profitable? And usually it's the center is not financially viable, and they're looking for ways to continue to meet their mission while also being able to cover their costs when they do that. And so usually when I start to dive into that, and others who have done this too. I don't think it'd be any surprise to anyone, but it's usually one of two things that are create the challenge. Has to the first challenge is occupancy costs. So, and what I mean by that is that a center that's not meeting expectations, very often the center was built and it wasn't aligned, it's not aligned with the market that's there to support it. So, in other words, the overhead related to occupying that space is just so great that you can be doing a fabulous job inside the four walls, but it still can't support itself. And that's all part of doing analysis. This isn't an intuitive process when you're developing a center. It's a science. And what you have to do is you have to evaluate the market, understand the market that you're going to be serving clearly, and go through a process that in the end, you can actually very accurately project how many people you can attract from that market and serve within that market through your programs and services that you offer. Once you know that number, you then have to have the discipline to use that number as you make every decision through the development process. How many square feet? How many square feet dedicated to this program and this service and how much equipment and on and on. And so it's really a discipline. And when you find centers that aren't meeting expectations, they either haven't done that research or they've done it and said, well, I hear what the research is saying, but we're going to do something a little bit different. And what I can tell you in my experience is this: anytime that an organization goes through the process and has the discipline to use the data to drive what they develop and operate, the center is successful every time. And and every time when they go through the process and don't use the data, it's not meeting expectation. And so that would be a real takeaway from my perspective is you have to use the data to drive any kind of project that you're developing.
Yeah, so so it's less of like it's old fitness centers or it's new wellness centers or it's big wellness centers or small wellness centers that deal with these challenges. It's more of how are they using the data that they have around the optimization of the business side of this thing, and are they staying disciplined to know whether they're fitting in those parameters?
Yeah, exactly right. And the other part of that, so we were talking about occupancy costs, but as you know, right now in today's day and age, the cost per square foot is just astronomical, and so it definitely
Hmm.
what we have to do when you now look at more recently the successful centers, they're figuring out ways to do the same things programmatically in less space. And so it's a whole design and development process of being very efficient in creating and utilizing space. And that's one of the challenges around centers that aren't meeting expectations. The other is labor, right? The increased cost of labor. So there's things that, and Dave and I could talk about this for a long time, but there's things that were sacred cows before the pandemic in terms of how we staffed and operated that we would never dream of changing. And in today's world, we have to really be looking at staffing and efficiencies differently in order to make things work because rents and construction costs and labor make the model challenging. Having said that, I will tell you that I could not be more bullish or optimistic on where medical fitness and wellness is headed. Every health system, in my opinion and in my experience, are talking about if they don't have a project or a center, they're talking about it or planning it. And so the only difference that I see today is that it just is the process is taking a little bit longer because of occupancy costs and figuring out the financing aspect of it and labor. But I fully believe in the next 10 to 15 years, every health system and community in the country will have access to this type of health and wellness programming and services.
It's really exciting. Yeah.
Yeah.
David, go ahead.
Yeah, Doug, I mean, we've worked together so many projects in the past, so it's I I love hearing these concepts because we we've talked about them so many times, and I remember working on some things around both of those two aspects. Making sure you're using the space that you have appropriately, and then in new projects, not overbuilding, despite the administration's desire for various aspects, but staying true to some data, and that really did help with some of the success factors. And then the other side on the staffing, and that's, I think, one of the most challenging parts is keeping the labor in line with things. And so we looked at productivity measures and coming up with some the MFA benchmarks being something to really pay attention to. Can you talk a little bit about some of those things?
Oh, sure. I mean, again, it kind of comes back to this whole concept of science, the science to what we do. And whenever we're looking at a center, either one that I'm operating or someone that I'm working with, there are things that we need to understand about the performance of the center, and the benchmarks are outlined clearly in the MFA documentation and benchmark for success document. But immediately, if you go through that process and you start to compare an existing center to the established benchmarks, you can start to see, where we're hitting targets, and where we're meeting established KPIs, and where we might be falling short. And then you can start to clearly put a plan together to revitalize that business. So, as an example, we keep talking about labor, or I brought it up, but I mean, it is a challenge because labor has gone up significantly. But having said that, it is still critically important that your total employee related costs, so that means wages and benefits, fall under the 50% threshold of total revenue in a given period, if you expect the center to be successful. And at this point, I want to just hold up for a minute and talk about we talk about a successful center. What does that mean? And so, just so we're on the same page, I mean, a successful center that is one that is, number one, producing meaningful health outcomes for the participants that are involved in the program and services offered. Number two, it does so in a way that the center requires no level of subsidization. So in other words, it's covering its costs and contributing to the bottom line of the sponsoring organization, whether that's a healthcare system or something else. Critically important. And I want to I just want to go a little bit further on this. I know there are examples and people who may be listening to this at some point that will say, well, we get all that, but our CEO says, just don't worry that you're losing a little bit of money. We just want you're doing great work for the community. It's really good optics for the organization, and just keep doing the good work you're doing. And I get that, but I'm telling you, as a professional, in a medical fitness professional, it's your responsibility to make sure that whatever you're doing is producing meaningful health outcomes, but it's doing it in a way that it doesn't require any level of subsidization. Because, and we've seen this, I know Dave, you've seen this many times. You can have an organization like what I described, where the CEO and the executive team is supportive of what's happening, even though there might be a slight loss. But when there's a turnover in leadership, and you get someone new in that position, right away, they're looking at this department. They're saying, this department is losing how much, and what are we doing there, and why? And all of a sudden, the program is at risk. And so, if you want to ensure the long-term viability of the great work that everyone in our profession does for many years to come, and make a difference in the health of the community that center serves, you are completely responsible to make sure that center does the great work you do, while making sure that there is no level of subsidization required.
Well said. Yeah, I think it's the concept of no mission without a margin, right?
That's
We've
exactly
heard
right. Exactly. And it's
that's
so
the
true. It's so
yeah.
true.
Yeah. So
Yeah.
go ahead, Thomas.
Yeah, sure. Well, I just wanted to share, because Doug, as you were talking, those listening couldn't see David and I just shaking our heads the entire time that you were talking there about Yeah, of course, the financial side it needs to satisfy its own needs. And the PT industry is a really good example of this, where there's a model of discharge programming, where private practice clinics in particular have tried out this model of having a discharge program within the facility and hiring staff for that. And so many of those programs, with the private practice PTs that I've spoken to, have been short-lived programs, because the private practice owner doesn't have the wiggle room that, for example, hospitals do to cover costs for something that loses money for a long period of time. And they're not resilient programs if they don't make money and have an intuitive model that is really valuable to the consumer to drive enough people there. I'd love to talk to you more about all this stuff, but David's got another question, and I should let him ask it now.
But no, there's a lot of similarities, in what I was touching on and what you just shared, Thomas, as
Yeah.
well. Yeah.
Yeah. Unfortunately, I don't think enough people are trained on the business side to the level they are on the exercise and clinical and programmatic side. And so they get into a position where they're not really even sure what to do. And so, unless you have an expert to help guide you, it becomes a really difficult situation. I learned that very early in my career, and I went out and got the MBA, and
Yes, you
talked to a
did.
bunch of people that I knew were doing great things, and so that's all part of it too.
Yes, yeah, yeah, it sure is, David. Uh, of course, um, you're right. I mean, everyone gets into this. I shouldn't say everyone, but most of us got in this because we're passionate about physical activity, nutrition, and health education, and what that can do as it relates to helping people manage, prevent chronic health conditions, right? So that's why we got into it. But the reality is, it is a business, and it needs to be treated as a business. And so that's okay. It just presents a little bit of a challenge, but you do have to learn the business side. And so how do you do that? I mean, like David, you mentioned, do have an expert that you can talk to, but I would suggest that's why we have our professional associations. Um, that's exactly, I mean, getting involved with a medical fitness association, that's exactly where you're going to meet people that have this business expertise and have had success over the years. Also, all the publications that come out are really, in the benchmark publication, and all of that information is there to help people really become students of the business, not just of the programmatic risk reduction activities that go on within a center like this.
Yeah. So, Doug, you've been doing this for all these years. You pioneered, I think, just a lot of the concepts in place today for the medical fitness model. What aspects of the medical fitness model do you feel really differentiate it from a traditional fitness model, and how are the best facilities implementing that model? And maybe just for those who are listening or just starting out, what are some good steps to take initially for the medical fitness model?
Yeah, I hope I got all those parts of that question, but we'll get we'll get there. I mean, I think it's important first, maybe just to talk a little bit about, who do these centers serve, right? I mean, who is our market? And it's really interesting. And if someone told me, years ago that wherever you deploy a medical fitness market, or a medical fitness center, wherever you deploy that model, that it will attract basically the same demographic, no matter where you were in the country, I would tell you you're crazy. There's no way. But honestly, it really does. The medical fitness model tends to attract, uh, give or take a few points one way or the other, a more mature, deconditioned, higher risk population. Number one, the average age in almost every case is about 50 years old, somewhere in that range. 50% of the members within the centers have never been a member of a health club before. It's their absolute first experience. And 50% are there because they're using physical activity, nutrition, and health education to either manage and or prevent some chronic condition. So they're either and they're there because they've made a decision on their own to engage in those programs and service in those programs and services to help them manage or prevent chronic conditions, and or their physician has recommended that they do that. So it could be one of either of those cases. So we have that, but then there's a secondary market, and the secondary market is the family members of the primary market. So in these centers, there's a lot of time, effort, and resources devoted to helping our youth engage in healthy lifestyle habits that they can learn and get comfortable with and maintain for a lifetime. And so there's a lot that goes on in these centers. You know, the mark, you know, it doesn't mean that there aren't people there that are very fit and have different goals or, you know, I'm in part of a number of centers that have a sports medicine connection to them. And so, you know, there are many centers out there that do deal, some of their efforts deal with high performance training and athletes. But primarily, the primary market is what I just described, and so that's how that's the group that's unique about the center, and why I go into that is because um, what commercial health clubs and again believe me, commercial health clubs do an amazing job with the market that they focus on. But when you look at the data, 30 years ago they were serving 15% of the population, and today it's still 15, 18% of the population. It really hasn't changed. And so in every market there's this big chunk of the population that's either been underserved or not served at all by the commercial health club industry. And these people know they should be doing something now. They wanna do something. They you know, we don't have we there was a time where we had to educate. We really don't need to right now. People, they've been watching Dr. Oz and Oprah and reading the magazines and the newspapers. They know they should be physically active. They know they should be making good nutritional choices, and they know why. But they're not comfortable going to a traditional facility. But what we found is they are comfortable going to their health system, you know, where they went when they had their kids, when they were sick. There's a level of trust there and they feel safe. And so with that comes a big responsibility. But that's why a medical fitness center can potentially go in a market and coexist beautifully with local commercial clubs that are doing great work in that market as well. So that's all part of what happens with this market, and also what creates this unique opportunity for medical fitness. You asked about the difference. So other than the market that's different, the people that we serve being different, the primary differences when you're talking about a medical fitness model is number one, medical oversight. And so when we talk about medical oversight, it means that every decision there's a typically, just like there's a medical director in a PT clinic, there's a medical leader, medical director as it relates to medical fitness, and they may chair a medical advisory board. But every decision that's made, whether it's introducing a new chronic disease risk reduction program, or um, whether it's purchasing a new treadmill or a new piece of exercise equipment, they're involved in that conversation, and they bring a physician's perspective to the decision making that goes on within the center. They're also very involved in you know, emergency response protocol and safety and everything else that goes on within this environment. So it really is a unique environment because of that. The second thing that makes the centers very unique is the topic of qualified staff. And so what that means is that every person within this environment has the appropriate credentials and qualifications to be adequate to address someone's health related questions and concerns. So they have those credentials to do that, and that's important because people want to know that the people they're talking to are qualified. In most cases, there's some requirements that the staff on the floor have a minimum of a 4-year degree in exercise physiology, exercise science, or some related discipline. But credentials are critically important, and I think it's also unique in the medical fitness model that you don't have to pay additional money to get expertise. So think about that for a minute. In many models that are out there, there's people that are there to provide customer service, but if you want expertise, you have to pay additional money for that. In most medical fitness center models, the staff is qualified and they're there. That's why you join. You're there to, and the staff has the ability to address your questions and concerns safely and effectively. And that's all part of what you get as a member within this environment. So medical oversight, qualified staff, clinical integration, which basically means that there's a number of clinical services within this environment, and that could potentially be integration can come in a lot of different ways. But as in my centers, we actually would share space, share equipment, and share staff where appropriate that would produce better outcomes for the member, the patient, and the business. But there's other forms of integration where you work with varying staff members with different credentials and expertise. So you use a multidisciplinary process to developing programs and services that create unique and special outcomes for the participants. And then finally is safety. This environment is the safest environment anywhere to engage in physical activity, nutrition, and health education. And so because of the expertise, because of what goes on within a medical fitness model, it's a critically important point. And when you ask those people that for all these years haven't gotten involved in a program, usually one of the number one reasons they found through surveys is that they don't feel safe. And so safety is critically important within this environment.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
So, Doug, to summarize, these clinics have some level of medical oversight and maybe even a multidisciplinary approach to the experience that the member or client or patient, whatever we call patients in this, or people, consumers in this type of facility, right? So there's a level of medical oversight and maybe a multidisciplinary approach. Safety is highly touted as an important value and something that is paid a lot of attention to. Staff are qualified and have some level of training. You may not have to pay additional money for medical expertise beyond just the entry-level fee. And one of the things I was curious about as you were sharing kind of that's my summary. Feel free to chime in if I forgot anything. One of the things I was wondering as you were going through that list is you mentioned a couple of times that medical fitness facilities have one of the differentiating factors is that they contribute meaningful health outcomes, that there's a health outcome or data to show that there's a medical benefit to participating in these programs. And how is that done in a lot of these facilities, I guess, or where does that fit into the model that you were just sharing?
Yeah, I think and David knows so well through the MFA that and MFA has a facility certification program where there's how many criteria is it, Dave? 120 or 23?
Yeah, 131 standards and guidelines. Yeah,
standards and guidelines. But many of those are and by the way, for those that are out there, that's a great thing to go through. I mean, there are some people that are out there that might think, well, we don't need that. We're already successful. We don't need a certification. But I will tell you, the process of your team working together to prepare for that certification is second to none. I mean, it's such a great exercise to make your center great. And passing it with flying colors is a great reason to go out and celebrate. So the reason why I went into the certification is because many of the criteria on there deal with outcomes. So the center has to establish that it is it's not only offering programs and services, but there's key metrics and measurements that are part of the process, so that when it's over, this program can be evaluated, and we can determine how effective that program was in achieving the objectives. So there typically that involves pre-assessment, post-assessment, and thorough documentation, and then debriefing at the end of the program, so that we can really spend time looking at the program and what we learned, so that we can improve on that, the next time that it's offered.
And I'll just share around that. You've mentioned the benchmarks that MFA has done for years, and we just did that a little over a year ago. But then we also, for the first time, were able to gather data from our certified facilities who are implementing the model that you're describing. And the results from the certified facilities, I wasn't surprised, but I was happy to see that in every category, they were outperforming the medical fitness industry as a whole. That subset was doing better. So it not only leads to these processes and high standards of achievement, but it also translates usually to business results, which is obviously great to see. But yeah, the the tracking of these programs that on both the health outcomes and the business financial side, I think are just so important to do. Um, so thanks for sharing that, Doug.
Yeah, of
Uh,
course.
My next question, Doug, you kind of already answered, but what you were sharing before I thought was really good. You're really knowledgeable about the medical fitness market, really the consumer that accesses medical fitness facilities. One of the things you mentioned is that we may only be accessing, let's say 20% or less of 20% or less of people in the United States as far as exercise services in general, right? Consuming some kind of fitness, less of that for medical fitness. And I'm curious, if we think about accessing that other 80%, like who could we get into medical fitness right now? Like who's the next one in? Who are the next people that we could access? If you can think of like who that population is that we really like, we should be on the precipice of accessing, and we're maybe just not quite there.
Yeah, but you said the key word, which is the buzzword, and certainly in my conversations, is access. And the question always comes up whenever we do a project or a center. Someone in the healthcare organization or the board or the executive team, they'll say, "Well, this is great on this side of town, but what are we doing for everybody?
Mm.
What are we gonna do for everybody?" And so that's really got a lot of us really thinking and through this process. And it's a really good point, is how do we impact not just one corner of the market's health, but everybody's health, right? Through this model. And I would start by saying that, we've proven that this model is extremely effective in improving health. And so, how do we bring this to everyone? And so, there's a strategy that several health systems are deploying now, which is called surround wellness, which basically means that they build, one or two, or depending on the market, maybe even three world-class wellness centers. But then in those part of the communities that won't support, because of all the things we've talked about, won't support a world-class or a large center. Um, we develop smaller centers, which we call express centers, and we strategically locate throughout the market, so that wherever you live or work, you have access to these programs and services and facilities. And the smaller centers, they can be subsidized by the margins that are generated through the flagship locations. So in totality, your business unit in that market is profitable, but there are some smaller locations that also include lesser costs, that make the model accessible to others. And so that's one strategy in a market. Again, I bring that up only because there's more than one health system now that's doing that. Um, but it really is about extending, these services and programs to the masses. And we have to get creative in how we do that, using technology, going forward, and uh, virtual education and programs and so forth. So that's all things that are on the horizon and really being implemented now.
Yeah, and one of your answers actually to my first question much earlier about really the financial side of things was around occupancy and how to reduce occupancy costs or be more efficient in the space that you're in. And I think what you were just speaking to speaks to that, right? Like, and it was actually a question I wanted to ask, but I think you just answered it in terms of technological integration or innovative equipment. Is there anything you would add to that, or things that you've seen that have been really unique?
Well, the one thing I would like to add to that is this: that when we talk a lot about and I use the term world class wellness centers, but they're comprehensive wellness centers that they're typically very large because they're positioned in a market that will support that, and they have a full outpatient continuum of care where we diagnose disease, illness, and injury in this building. So there's outpatient services. We can then treat patients through urgent care or freestanding emergency departments or outpatient surgery centers. We then can rehabilitate patients within this environment, and then we can prevent through wellness related and medical fitness type facilities and programs. So those are what I consider to be a comprehensive health and wellness center model. And those are being, again, I've been involved in the development of, dozens of those. But the thing I want to make really clear is it doesn't have to be big to be world class. And that's a really important message. One of the projects in the last 3 years that I'm most proud of is a small project just north of Columbus, Ohio, uh, in a rural community. It's actually built in the middle of a cornfield, and the health system felt a need to have a presence for this community, for the people in this rural part of their market. And this center, the total building is 60,000 square feet, but that doesn't really tell the story. Most of that building is primary care and subspecialty care and physicians. But 6,000 square feet of this building is medical fitness integrated with physical therapy. And so that's not a big space. And this center is absolutely spectacular in every way. So the equipment is spectacular, the staff is spectacular, the programming is spectacular, the experience is spectacular, and it's just an example that it's important for people to understand that when we talk about an effective center in a market, it doesn't mean that it has to be a $45 million project, in a big market. And I think that's an important for people to understand that.
Yeah, that's really cool, Doug. Mentioning that concept, because you've been in this industry and have seen so many things. You spent all the time with Cleveland Clinic and Akron General. You had your own world class centers. I've been to them a few times, and they're just amazing. What goes on in there, and really a great example of how to make it comprehensive.
And you too, by the way, Dave. You had
Well,
some.
and so, that leads into my question. You've been think back, if you can, maybe through your career, and you mentioned that one in Ohio that you were real proud of. Can you think of some other ones? Some of the projects that you've worked on, some of your accomplishments in the field that you're most proud of, and then maybe now, are there some things that you're involved with that you can share, a little bit about what's going on with them?
Wow. I gotta think back over 43 years. Let's see. Uh, well, I will tell you this. If one of the things that that makes that I'm maybe most proud of is the team of people that I worked with for 25 years with Cleveland Clinic Akron General, as we developed a medical fitness clinically integrated model that became extremely successful and started to be duplicated across the country. And what I mean by that is there are a number of people that when I started at Akron General in 1995 that I hired, and they were on line staff positions. And 30 years later, they're executives within the organization and leading centers and leaders in the industry and understand what makes these centers work and doing their part in advancing medical fitness and wellness. And that, I'll tell you, there's nothing that makes me more proud than to be part of that and to know that we created a culture where people really worked hard. We really worked hard, but we had a lot of fun and we really created something special. We felt like we were making a difference, that every day we came to work, we weren't just checking in and doing our 8 or 10 or 12 hours, but we were doing something special with those 8 or 10 or 12 hours. And everyone was on the same page. And because of that, we created something special that made a difference in people's lives, and then it also then they all started to advance in their careers, and to see that is just really special. So that's one of the things I'm most proud of. I will tell you, I'm really proud of where we started and where we are with the MFA right now. Back in the late 90s, early 2000s, I was one of a small group that took the risk and acquired the association on behalf of the industry. Again, I don't know what we were thinking at the time, but but we really believed that this was the future. This model was and the programs and services were the future, and that it needed a voice. And so there was value in an association that would be the voice for this industry. And so to see where that started, and now to see how it's grown and what it's done, and the kind of impact it's having, and the great work you're doing, you and your team are doing, Dave, is really rewarding, and I'm very proud of that. I'm really proud of our ability at Cleveland Clinic Akron General Wellness Centers. We built 3 world-class centers. I'm really proud of the fact that not only were they really making a huge impact on the health of the community, but we were doing it in a way that they were extremely profitable. So they were, and because of that, it ensured its longevity. In other words, there was a period of time where things at Akron General were fairly unstable, and I think we went through I don't know, 4 or 5 CEOs in a 5-year period of time. And I will tell you that there were 2 or 3 of those CEOs that said, this has nothing to do with filling beds. What are we doing here? And if it weren't for the fact that the centers were as profitable as they were, those centers would have been at risk. And so I'm really proud that we were able to not only deliver a program and service that made a difference, but we were also able to figure out how to do that in a way that it contributed to the bottom line of the health system. And then lastly, um, I love what I do. I love working with health systems. My work for the most part focuses around health systems and universities, and helping them plan, design, build, operate, and finance health and wellness center projects. And being there for that first meeting where we're talking about visioning, to the day when we cut the ribbon and it opens to the community, and then a few years later it's exceeding all projections, which happens often with these projects. And so to do that, or to take a center that's been kind of bumping along for a while, and you go in there and you work with a team, and just to see how exciting it is for everyone when things start to work, and you start to turn those businesses around. So those are the things that really get me fired up. And there's a number of just key projects. One that I'll mention is a newer one. Cone Health in Greensboro, North Carolina, is a fabulous, comprehensive health and wellness center that has exceeded all expectations. We projected profitability at 2.5 years. It hit it at 2 years. So now we've got the confidence of the board, and there's now plans that surround wellness strategy that we talked about. Is creating access in other parts of the market is exciting. We just broke ground on a beautiful project in Scottsdale, Arizona. We're working on one in Ann Arbor, in Richmond, Virginia. I mean, there's a whole. The point is, this is happening. It may be it's a little bit more difficult process working through the finance part of the equation, but it's but every I meet with in the work that I do, I get an opportunity to meet with a lot of executive teams in boardrooms, usually a couple a month. And the conversation always starts out, we're experiencing decreasing inpatient volumes, and decreasing reimbursement and increasing costs. But in the next sentence, they say, we recognize that going forward, we need to be treating patients in an outpatient environment whenever medically appropriate, and we need to be in the business of prevention. And that's exactly what a health and wellness center is. So again, where the industry started, where it is today, is just so exciting for me. I still have that same burning passion for what I do, and I don't see myself stopping anytime soon.
Well, that's great. I love hearing about how the people that you hired have progressed their careers and now are carrying on what you built, and that was one of the things. I just stopped in Hancock Wellness Center last week, and talked to some of the people in the same thing, the same situation. And I've got the same thing going down in Florida, some of the people that I worked with down there. And so that's when it's really, you look and say, okay, we built something that could last. And part of that is training everybody, and letting them be part of the process, and putting in programs and policies that last more than just one person. you know it would have been terrible if after I left, or after you left, things fell apart. But the way you build them to stand the test of time, I think that's great to hear. Your experience there. I wanted to say, if people didn't realize this, Doug, he was part of the original group helping start the Medical Fitness Association on the board and all of that. And so what he was talking about, I think it originally was a private individual having the association under it, even a different name originally. And then over time, the board decided to purchase it and take on some financial risk to let it be a nonprofit that the way it is today. And so we owe a lot of thanks to you and a few others that had that foresight.
Yeah. Well, thanks. I appreciate it. I don't know if my wife appreciated it at the time,
Yeah.
but, but but no, it all worked out. And people need to understand, we did not get any financial benefit from that. We signed on the dotted line for a line of credit that we could use to acquire the association on behalf of the industry, and it was a really great day when that line of credit was paid off. It's been a special journey. And I would just mention, and Thomas, I think you can relate to this. One of the things that works really well in these centers is that integration of PT and medical fitness, and it creates this seamless continuum of care. A lot of times in PT, the patient's really feeling good, and they as they go through the process, and then when they complete the reimbursable rehab, it's kind of like, all right, guys. Well, you can head down, 3 blocks and to the right, and there's a place that you can, and now they got to make another decision, and a lot, in this environment, everyone's in the same environment, and they're comfortable in that space. They're familiar with it. They know where they're going to park their car. They know how to get into the center, where the locker rooms are. And so it's really just this seamless continuum of care that's created, that really creates this unique experience for the patient, who then ultimately becomes a member. And that really is powerful in this model. So PT, cardiopulmonary rehab, are really some basic clinical services that are typically integrated within the model, amongst other things.
Yeah, I was gonna mention cardiac and pulmonary rehab if you didn't, but it's so true. To be able to have access to a post and even like within the PT plan of care type service for exercise, we're so limited, particularly in physical and occupational therapy, with what we're kind of allowed, to do with people within our plans of care, and the access to a medically oriented facility and even set of providers like exercise physiologists makes such a big difference in providing just a shot, right? At giving people the opportunity to change their behavior for the long term. And without it, discharge to a piece of paper feels really yucky. It feels really yucky to me. Discharge to the same set of exercises that you're doing right now. And if you want more, go to a gym down the road, like you're saying. It's just not good enough. So I'm really excited to hear all the work that you're doing. And this actually segues well, I think, into my next question, which is that, current state right now, as you said, they're spreading, but medical wellness centers are not yet widespread. Not every hospital in the United States has a medical fitness center. And while 82% of hospitals claim to offer some kind of health and wellness services, it's really less than 10% of hospitals that have a medical fitness center. And this, the source of this data I don't feel super great about, but I feel pretty confident that it's less than 10%. What can the medical fitness world do to show the necessity of these services within all hospital systems? And, you had mentioned earlier, let's be patient. Some of this is going to work itself out just by proving it works. But, what are the things that we can do now to show that we need to have this everywhere?
Yeah, we've already touched on it. Really, we have to continue to be diligent about showing and publishing outcomes. Right? People need to see that this works from that perspective, and we need to show that there's a return on investment. And part of the return on investment that I haven't mentioned, I mentioned a little bit, but is this halo impact. When you create a wellness center, it becomes a community hub where lots of people come in for lots of different reasons. They might be coming in for rehab, or to see a physician, or to get an x-ray, or to go to an educational program, or to meet with a personal trainer, or so they come in for lots of different reasons. And they get really comfortable and familiar with the sponsoring healthcare organization through that. And then when they need care, and that's where they tend to want to go. So the clinical services that are co-located within the wellness center, there's a lot of documentation, excuse me, that shows that those centers, as opposed to being their own siloed clinic somewhere in town, when they're part of this hub, their volumes, their revenue, everything elevates, and that happens to everyone within. And then the other piece of this, which hospital administrators don't like to look at, even though they recognize it exists, is downstream revenue. They never like to talk about downstream revenue, but it's a real thing. And so that is all. Those are all things that happen. So we need to continue to do a good job, and even a better job, of documenting outcomes, and then the return on investment of this type of model. And as long as we can do that, I think I think we're going to continue to see the growth. I will say that one of the challenges, Dave and I have talked about this, is CEOs. Most CEOs get that they should be in the business of prevention. They should be working hard to keep people healthy and well and out of a bed. They get that in this new world and in the healthcare horizon. But they're also, they're not partial to any way to getting there. In other words, they want to whatever they can do to accomplish that goal in the most cost-effective way is what they're going to lean towards. And so, the challenge is, do you have to invest in a $20 million health and wellness center to get some kind of outcome? Or could I invest 5 million in some kind of a educational call center that might produce similar outcomes? I'm telling you it wouldn't, but I'm just trying to use that as an example. It's the way the executive, the CEO, is thinking, that they're not, they get they get what we're talking about here in terms of wellness and prevention and chronic disease as it spirals out of control, and they need to be doing something about it. But we're needing to prove that the that the health that the medical fitness model is the most is the most cost effective way to accomplish those objectives. And I think there's data. There's some organizations out there that are doing a great job with research around that, and the more research on that topic, the better. But as long as we continue to do those things, this is going to continue to grow and move until, again, what I said earlier, I really believe that this is something we're going to see in every community and part of every healthcare system's continuum of care in the next 10 to 15 years.
Yeah, that halo effect. I can remember back when you and I were working on the McCordsville Hancock Wellness Center project, and we're building a new facility, and we're bolting it on to an existing medical office building that had physical therapy and some other diagnostic and medical services, and it was a perfect situation to be able to really look at that downstream revenue to kind of prove what can happen, because we were then able to look at, okay, in the year prior to the wellness center being built and opened, what were the volumes in rehab and physical therapy and so forth. And then once the wellness center opened, we could look at, okay, what was that true downstream revenue? What was that halo effect of having a wellness center and that environment? And we were able to see over 100% increase in volumes. And so, I mean, that just really was enlightening, I think, for everybody, including the hospital administration. I think it really helped when we were looking at building the third one in New Palestine, and so yeah, I think that concept was presented. I don't know if everybody believed it for fact, but then we were able to actually see it, and so
Yes.
it really proved the what you're talking about. But yeah, I think the more of those kind of things that we can get to continue to show that effect of, why should a hospital have it? Well, there's many reasons. There's one, and there's many others, like you've said.
Yeah, and there's others that we really haven't got into that conversation, but I always ask executives, why are you thinking about doing this? When they're going to build a project, or I get a phone call, and number one is the brand. I mean, it changes your brand. You become known as the organization in town that truly cares about keeping people healthy and well and out of a hospital bed, and you're putting your money where your mouth is. They're making a sizable investment in that belief. It also fits in the mission, usually, about keeping the community well. But one of the other things is these centers are being used strategically to either attract new or protect existing market share because of the community hub nature of it. When you build a center like this, health systems will put it in a market they own and they want to protect from competition, or they'll put it right in their competitor's backyard. So it brings people in and gets familiar with them, and then they jump their competition and go to them. So there's a lot of reasons why this makes a lot of sense, both from a business strategy perspective as well as a health perspective.
Well, Doug, we've been going for a good hour here, and we could probably go for a couple more hours with your
Absolutely.
experience and all the things that you've seen and done. But I just wanted to really thank you for this time, and you're a staple at the Medical Fitness Association events. We just got done not too long ago with the Medical Fitness Leadership Institute, and you gave a great talk there that I think everybody needs to hear some of the concepts that you present there. You're presenting at our annual conference this year down in New Orleans, and so but really, other than that, before we get done here, other than meeting you in person, which I do think is a great thing that some of these events allow for, meeting some of the industry gurus. People have been doing this and really can help others, but you know where how do you think our listeners that want to get in touch with you? What are some of the best ways?
Oh, with me, just you can either shoot me an email at D Ribley, Ribley, and the number 5 at gmail.com, or you can call me at 330-472-4115. And I would just encourage everyone, whether it's me or there's lots of great, people out there in the industry, including all the experts at the Medical Fitness Association. But, it's one thing to stay in your bubble as a professional in this industry. And when I say your bubble, your place of work. Um, but the people that are most successful are those that not only excel within their bubble, but they go outside of the bubble and they give back to the industry, and they seek out opportunities to make a difference in the industry as a whole. And you can do that through your association, your professional network, and I tell you that comes back tenfold. I know David, I'm sure Thomas, I know me. If I have a question or I'm in the middle of some difficult decision, I can call 10 people and get their experience and expertise, and they're happy to share it. So I would just encourage those that are listening, if you haven't established a professional network already, get outside of your bubble, do work in the industry to advance the industry, because in the end, it helps you as well. And you can do that through the MFA really well.
All right. Well, thanks again, Doug. Thomas, any last words?
No, this was really great. A really great pleasure to meet you, Doug. Learn about your experience, and just a really, I know this will be a really valuable episode for our listeners to listen to. So thanks so much for your time and expertise.
Oh gosh, I appreciate what you guys are doing. This is really important and meaningful work. Thank you.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.